tell you something about corrosive injury of the food pipe and stomach. What is this corrosive injury? How does it happen? Actually, school going children, especially when they are in the area school final, or even sometimes the goldsmiths, in a fit of anger or despair, they suddenly drink acid. You know, they either drink bathroom acid like sulfuric acid, or they may also drink Harpic and other toilet cleaning solutions which are alkaline, and in an attempt to die. But it's unfortunate that they don't die, only that their food pipe and the stomach will get severely injured, and you know, they have blood vomiting and some breathing difficulty, and they will be alive to be brought to the hospital, and there one puts an endoscope to check what happened, and you can find out that there is an injury to the food pipe or the stomach. And some hospitalization for a few days, it will make them slightly better, and they will be able to drink milk, water, and then they will go back home. But at about 4 weeks from that period, suddenly they will not be able to drink water or not able to swallow their saliva. That is when we understand that the whole food pipe has become like solid and completely blocked, and that is when the problems arise. Because once you are not able to swallow saliva and keep spitting, and definitely not able to eat food, so they will keep losing weight, they will become skin and bones. That is when they come to the doctor or the surgeon. So here, when such a thing happens, we evaluate the patient. Many times it is possible to dilate the food pipe through an endoscope. We put a wire into the food pipe, and over the wire we will put a plastic tube and a balloon and try to dilate it and make passage. But these are usually temporary. At some point of time, if the stricture is too long or too curvy, we have to do an operation. What operation is done in these patients with corrosive injuries? That we have to put the colon in the large intestine in the place of the food pipe, so that they will be able to eat. Sometimes stomach, if it is available and not injured, that also can be brought up to the neck and sutured, so the patient will be able to eat food. So anyone who tries to end their life by drinking acids or bathroom cleaners, alkalis, will get into severe trouble. They don't die, but they get into a near death situation where this food pipe stomach is totally injured, and when it heals, it will form a complete blocked tube when patient is not able to eat food, and that is when we have to make alternative passage for the passage of food and swallowing saliva. And there are many operations available to do that, which are quite complicated. But then again, whenever anybody, you should also be careful with children when they are playing around, when in the toilet cleaners or acids are kept on the floor, because the children sometimes might drink that thinking it is water and then get into trouble. So these acids all are kept in a very safe place, and by mistake should not be left on the floor. Thank you.